Hi everyone, my name is Simone Shaw. Welcome to Leadership Theory. Today I will discuss contingency leadership theory, continuum theory, path goal leadership theory, leadership substitute theory. So, let's take out your binoculars and look at the bigger picture. As a leader, how well can you adapt to different situations? Well, contingency leadership theory, founded on the principle that no one or single leadership style is appropriate for every situation or circumstance. It focuses on the concept of adaptability. So, who was the mastermind behind such a theory? In 1951, an American businessman and management psychologist, Fred Fielder, put forward the contingency theory, also called situational leadership theory. The theory proposed that there is no one size fits all approach to leadership. The leader must adopt the leadership style to the current situation to be effective. Applying the contingency theory to navigate challenges. 1. Assess situation. 2. Tailor your leadership style to suit the situation. 3. Be flexible. And 4. Continuous monitoring and adjusting. I am a registered nurse by trade. So, how can this leadership theory be useful in the healthcare industry, where there is sometimes a need for great urgency in emergency situation? Hence, the need for the quick piloting of staff on the part of the leader. There are several points to bear in mind when thinking about the healthcare industry and leadership styles. The healthcare industry is fast paced, ever evolving due to continuous research and changing technology. It requires a concerted effort to provide high quality healthcare. It is diverse and complex, and it has a vast array of skill set. Being a contingency leader at a hospital, I should be able to recognize a crisis. For example, Code Blue, where a more direct hands on approach is crucial to ensure swift decision making and coordination of care. The leader manages resuscitation efforts by overseeing high quality CPR, keeps the team organized and on track. As a leader, I'm also responsible for backing up any team member when appropriate, providing constructive criticism, coaching, feedback, and debriefing. It is my duty to understand the life threatening code protocol, assign roles, and delegate duties, and make appropriate treatment decision. For of course, it is a life threatening scenario. While, on the other hand, during a non emergent situation, I will have to ensure a more supportive, participative, and empowering approach to leadership. As I would consult with employees to ask suggestion on the gaps that exist, how we could improve quality healthcare, and implement strategies to motivate and to support employee work satisfaction. The continuum theory. Psychologists Robert Tannenbaum and Warren Schmidt developed their continuum model of leadership in a paper published in Harvard Business Review in 1958. The continuum has seven components. It includes tells, sells, suggests, consult, joins, delegate, and abdicate. So remember, we are looking at these in the context of the healthcare industry. Tells. As a nursing leader, authority is sometimes absolute, where I make a decision and others follow. For example, assigning nurses to patients, or when there is an admission, I would review critical labs, values, and history, deciding whether or not the patient is appropriate for the floor or will need higher level of care. Cells. As a leader, whenever I want a quick fix to conformity, I will explain the process behind the decision making. By adopting this approach, the aim is to persuade nursing staff the decisions are valid. Portney 2020 declares that because there is presentation of evidence based research, employees are more willing to buy in on the final decision. At my hospital, this is mostly done through yearly nurse competency forum. Third, on the continuum, suggesting before and after shift huddles, as a nursing leader, I would offer a range of options for nurses and staff and then allow a consensus to form around the best course of action. Fourth, consulting. During nursing management rounding, the leader would propose a decision, then invite input and discussion, which allows the healthcare team to influence the final outcome. This way, the team feels acknowledged. Fifth, joining. As a leader, I will sometimes present a problem and ask nursing staff for solution to allow for decision making to be a collaborative approach and staff would feel valued and trusted. 6. Delegating. Leaders have a high degree of confidence in their team members. They may begin to delegate more and more decision making responsibilities. 7. Abdication. In coaching prospective nursing leaders, I would ask them to look for gaps that exist in patient care on the unit and decide how best to solve it to develop their competence as a leader. The path goal theory, developed by Robert House in 1971, it explains how the leader should change their path, which is the leadership style, with the hope to achieve a particular goal. Directive leader paired with subordinate characteristics of preference for structure. Supportive leader paired with subordinate characteristics of need for affiliation. As a leader, I am responsible to make employees feel a part of the team. Participative leadership paired with the subordinate characteristics of desire to control. During performance appraisal, ask questions such as how can I improve the unit environment? Achievement goal oriented leader paired with the subordinate characteristics of self perceived level of task ability. The leader set clear challenging goal for the subordinate and usually a benchmark or goal is set. The leadership behavior stresses high quality performance and improvement over current performance. For example, initiating and sustaining fall risk prevention protocol, the prevention of hospital acquired pressure ulcer protocol, fast activation of suicide precaution when dealing with patients who score high on the Columbia Suicide Severity Rating Scale. Leadership substitute theory, first developed by Stephen Carr and John Jameer in 1978. Substitute leadership theory are characteristics of the task, subordinate, or the organization. These characteristics can neutralize the effects of the leader's behavior. Task characteristics, structured routine, unambiguous tasks, feedback provided by tasks, intrinsically satisfying tasks. Subordinate characteristics, experience, ability, training, professional orientation, indifference towards reward offered by organization. For example, working with highly skilled nurses means that there is less need for my supervisory instruction, facilitating shared leadership. Organization characteristics, cohesive work group, low position power, and formalization, explicit plan, goals, and areas of responsibility. Organization characteristics, inflexibility, rigid, unyielding rules and procedures. Leader located apart from subordinates with only limited communication possible. The characteristics of the organization make the leadership less necessary, as when work rules are clear and specific, the workers know exactly what they must do without help from the leader. In recent years, we have incorporated the use of facilitators on each floor to help guide and coordinate nursing tasks, shifting, neutralizing, or sharing leadership. Being a nursing leader means something more than gaining authority or charge over colleagues. With this title does come the power to affect successful outcomes. But it also comes with something more, the power to shape the career and personal growth of subordinates. Leaders apply different leadership styles to influence the success of an organization. A solid knowledge of leadership theories creates a highly skilled leader.